Dr. Lois Ombajo, who's an infectious diseases specialist at the University of Nairobi, joining me now. Dr. Ombajo, it's good to have you again. So explain to us just what is going on in the country right now.
So thanks, Yvonne. So I got a blackout. I'm really sorry I dropped off the call. So as I was saying earlier, many people will have noticed that in the recent past, a lot of people are presenting with features of headaches, sore throat, cough, joint pains, a lot of fatigue. And these are general features of an upper respiratory tract infection. So the upper respiratory tract would be anywhere starting from the nose to the back of the throat, down the throat to the upper part of the airways. If it goes down to the lungs, then we call that a lower respiratory tract infection. So many upper respiratory tract infections are caused by viruses, different types of viruses. So in the past, you've had people talking about the influenza virus. So if someone has the influenza virus causing an upper respiratory tract infection, then we'd say they have the flu. But there are other viruses that can cause this as well. And more recently, what has been of interest is the virus causing COVID-19. And over the last week or so, many hospitals have reported that most of the tests they're doing on people who present with these features of upper respiratory tract infection have been found to be caused by COVID-19. So at this point in time, a lot of what we're seeing is likely to be COVID-19.
Yeah, and that is an interesting thing because, many of us are wondering, the symptoms are just about similar, the upper respiratory tract infections and the symptoms seen there, but they've been accompanied by headaches. Some people have reported diarrhea, vomiting, and nausea. So, I think many of us are asking, for instance, if you have what could be a flu or something that is similar, does that make you particularly more vulnerable to COVID-19? Dr. Ombajo, is there any relationship between the two?
I may have missed the first part of what you said, but the symptoms for the two are very similar. So someone who has flu, you may not really be able to differentiate on the basis of the symptoms whether someone has flu or has COVID-19. So far, we don't know that having one, for example, having flu really predisposes you to getting COVID-19. We don't have any information on that. But what we know is that it's very difficult to differentiate between the two. As I mentioned earlier, most of the tests being carried out now are because we are finding that the cause of these infections that we're seeing is COVID-19. Earlier, maybe around September, October, November, we saw that there was a bit of flu going around, especially among school-going children. But in December, most of what we're seeing is because of COVID-19.
So how does one know when to actually seek a test for COVID-19? Because you say the symptoms are, quite similar. So at what point, Dr. Ombajo, should one then say, look, I'm having symptoms that are like the flu, like COVID-19. At what point should they then consider isolating and testing for COVID?
Generally, if someone has features of an upper respiratory tract infection, then they should consider isolating. So if you're having a running nose and a cough, that's not the time to go out there, because whether it's flu, whether it's COVID-19, chances are that you're more likely to pass on infection to someone else. So generally, when someone has symptoms, they should consider isolating at home. As I said before, it's very difficult to differentiate just on the basis of symptoms whether one has COVID or flu. So what I would advise, it's difficult when so many people are sick to get every single person tested. Yeah. But if someone has more than mild symptoms, then they should get themselves tested. And the reason for this testing is that if someone has severe disease, then we can offer the appropriate treatment, whether it's flu or COVID-19. So, for example, if someone has severe symptoms with flu, there are certain antiviral medications that will be used with flu. If someone has severe symptoms and they have COVID-19, then again, there's some medicine that would offer in that context. It's also good that when you go into hospital, we know what the oxygen saturation is so that you're appropriately treated, and we determine whether someone needs admission or can be taken care of at home. So for most people with mild symptoms, they probably can stay at home and just observe. But if symptoms are getting worse, then it's time to go to hospital and it's time to get tested.
All right. So, Dr. Mbajo, what you're saying is if you have any of these symptoms, the best thing to do, even if you are not able to get a test, is to isolate yourself. And considering we're going into a festive season, people are coming together, persons will most likely start traveling, as soon as next week, meeting together as family, extended family and friends. How do we manage ourselves with what's going around and considering the season we're in? That's a good question, especially because we all want to get out there and celebrate with family and friends. But I think the best thing we can do right now is to ensure everybody has a mask. So the mask protects you from getting possible infection from other people, but it also protects other people in case you have infection. So as people get out there and meet with family and meet with friends, one, there's certain things that we'll have to do. Let's avoid large gatherings. Let's be careful to meet in open spaces, have windows open or meet outside as much as possible, and let people have their masks on as much as is possible. So this one will ensure that we are protected and that we also protect our loved ones and the people around us. The other thing going forward is that as more and more vaccine is available, we really encourage more and more people to get vaccinated. And for adults, it's also important to know that there's a flu vaccine, and it's important that we check in with the hospitals and healthcare providers so that we're able to get an annual flu vaccine as well. But for the immediate future, for the next few weeks, as people go around, let's remember to keep it out in the open as much as is possible. Let us remember to wear our masks. And if you're sick, stay home, avoid going out to meet with people when you have symptoms. Thank you very much, Dr. Lois Mbajo, who's an infectious diseases specialist at the University of Nairobi. You heard it from her here on The Explainer. If you are feeling unwell, isolate, stay at home, manage it, and hopefully if you're able to, go for a test and seek further medical attention. That's our Explainer tonight.